So all the ambulances are set up basically the same way. You've got all the airway stuff up here, so depending on what level of paramedic you've got at a call, will depend on that will dictate what we can use and what we can't use. There is stuff here so that we can do advanced airways, so intubation, endotracheal tubes, the kind of stuff that doctors do in hospital. We've also, bag valve masks. We've got all the suction equipment to deal with a number of things, child-sized masks. All that stuff is up in that area. You come back here and you get more of the circulation stuff. So we've got defib pads, monitoring electrodes, spare supplies for our monitor, and then we've got IV equipment, so all the IV catheters, all the fluids that we would give somebody if we started an intravenous, all that kind of stuff. And then in the back we just got all the basic stuff, the linen, first aid supply. In an emergency department at a hospital, this is about a $40,000 piece of equipment. We can defibrillate somebody, we can do 12-lead ECGs, we can do 3-lead ECGs. A 12-lead ECG is diagnostic, so we can actually pretty much diagnose a heart attack or a myocardial infarction. Pretty much, because you got to back it up with labs. So we can also pace somebody, so if somebody has a slow heart rhythm, then we can actually do an external pacer on it. So it's like what an internal pacemaker does, except we're not going to do surgery and insert a pacemaker. This takes the place of that temporarily until they can get them into surgery and put an internal pacemaker in. So we've got that. We've got equipment to monitor our endotracheal tubes once they're inserted. I think that's about it on that. Mm-hmm. And then our trauma bag here, we carry our drugs in it. We carry first aid equipment.
This gets brought into a scene, so there's intubation kits, an IV kit, all our medications in there. So if we need to intubate somebody in their house versus having to bring them out here, we can do everything with this bag. So
yeah. So we've got some IV stuff in here. We've got our drugs. We've got, as Dory said, intubation equipment. We've got the gear to perform what we call a surgical airway. So if somebody had an airway that was obstructed for whatever reason and we couldn't clear the obstruction, we can basically make a hole in their throat and insert a tube so that we can help them breathe through that. We've also got equipment to do a chest needle, so it's to decompress basically a collapsed lung. And then these are all the drugs that we can administer. So we've got epinephrine, atropine. These are all frontline cardiac drugs that we give primarily for cardiac arrest. We can also give epinephrine for anaphylactic reactions, so severe allergic reactions, and also for severe asthma attacks. We also have this is heparin, so this is a clot busting drug. Basically, it's not really a clot buster; it's more of a blood thinner. But we give that to people who are having what's called a STEMI. A STEMI is an ST elevation myocardial infarction, and that's where the 12-lead comes in. So when we do the 12-lead, if we see that they're showing signs of this ST elevation MI, we talk to a cardiologist at St. Boniface an interventionist at St. Boniface, and they will we transmit the ECG to them. And if they agree with us that this person's having a STEMI, then they give us orders to give the heparin, and this is a precursor to the person going in and receiving what are called cardiac stents.